In 2022 and 23, we dropped 100,000 RNs that were already in practice.
100,000? Oh my goodness.
Welcome to Being the Change, the official podcast of James Madison University, brought to you by Madison Magazine. Each episode brings to you stories of how members of the JMU community combine intellect with action to live lives of purpose and meaning. That's Being the Change.
What's up, JMU? Welcome to Being the Change. Andy Perrine here. Today we're going to be exploring an interesting but also very critical situation in the Commonwealth, nationally and internationally, that focuses on the shortage of folks going into healthcare, especially nurses. And with us is the head of JMU School of Nursing, Dr. Melody Eaton. Dr. Eaton, welcome.
Hello, Andy.
Great to have you. Dr. Eaton serves as the director and academic head of the School of Nursing at JMU, and she, you'll be glad to hear, is also a purple bleeder. She got her undergraduate degree at JMU and then went on to get her advanced degrees at GW and at Mason. But she's very widely published on topics including the effectiveness of home health care, and she's a founding member of the JMU Health Policy Collaborative. But she's also very active in state and national nursing associations. And so she's got a terrific vantage point from which to help us explore how this crisis has really evolved in the shortage of healthcare workers, especially nurses. And then what JMU is doing to solve this problem. So, Dr. Eaton, there is a shortage of nurses in Virginia, and you're very involved at the state level. Tell us how critical is the problem?
Well, Andy, we have a national nursing faculty and nursing staffing shortage.
Mm-hmm.
It was really exacerbated by the pandemic
Sure.
that we've just experienced for several years.
A lot of early retirements and changing careers because of the burnout.
Absolutely.
Yeah.
And just deciding they didn't want to do it.
Right.
They didn't feel supported
Right.
In practice. I think in Virginia alone, in 2023, out of 12,568 qualified applicants to RN programs in Virginia, 3,304 were not given admission or offers because of room and capacity, a lack of faculty. So we do know that nationally and at the state level, it's not just one area that's affected.
Right.
It's practice, it's the staffing in the hospitals and being able to retain quality RNs, and it's the education piece, being able to provide that education to qualified applicants so that they can go out and be healthcare providers. Nursing's been really captured in this area, just due to the really exacerbated shortage that happened during COVID. In 2022 and 23, we dropped 100,000 RNs that were already in practice.
100,000. Oh my goodness. And beyond just the capacity of the schools, we're having trouble finding places for our students to get their clinical hours too.
Absolutely.
Right.
So it's really a joint effort between practice and academics to make sure that students get the education they need and that they're practice ready, and that they have a place where they feel mentored once they finish their education.
Right.
And I think 2023, there were statistics out there that showed that that the majority of staff leaving the profession were newer RNs. So they were out less than 3 years.
So this problem's got a long tail.
It does have a long tail. Right. And the International Council of Nursing really called for this joint effort for education and practice to work together to solve the problem and look at long-term solutions. In Virginia, I can tell you that we had 47 vacancies last year in nursing faculty vacancies.
And this is in the entire state?
This is in the state.
Wow.
This is public schools in the state.
How bad is that at JMU?
We have a 10% vacancy, which is in line with the 10% national vacancy that's existing. So we're working on ways to really attract faculty and retain qualified faculty. And I think what's really helped at JMU, because of our culture and our support from administration, we're really involved at the state level. Yeah. We have great government relations representatives. And during my past position as the president for the Virginia Association of Colleges of Nursing, I worked directly with our government relations at JMU to really facilitate a 10% faculty salary increase for schools in Virginia.
And that happened last year?
It was in 23.
23. And that was a pretty significant boost to the faculty in your program.
It was, and it really helps. I can say that our applicant pools are double what they were a year ago
because of that boost in salary.
I'm sure that helps.
Oh wow!
So not amazing. Just that we're wonderful to work for,
right?
But salary matters, but also the environment and culture matters. And I think at JMU, we have a culture that's really collaborative. We work across programs. We're not in silos, and our programs, not just within our college, right, of health and behavioral studies, but across campus. Right. So we offer programs to students at all levels that not only prepare them to be advocates for their clients, their practice, and their communities, but help them work together with other disciplines so that they're ready to go when they graduate.
Well, we started this conversation off with talking mostly about numbers, about the quantitative issues facing the healthcare industry, especially in nursing. But what you're getting at is a qualitative issue, which is near and dear to my heart because we talk about the culture at JMU a lot on this podcast. Describe for me what you see as somebody involved in the healthcare industry broadly. Describe how the JMU student might be different from other students once they take their roles in their careers.
I think I know our JMU students stand out in their practice readiness to this date. And that has been the biggest concern that our practice partners have is that students don't come out ready, they aren't resilient enough, they aren't prepared to really critically think. And I would say that that's one big thing. And in our School of Nursing, we're rigorous, and the culture of our school is really to help students process, help that professional behavior, help them to seek out information when they don't have all the information, and question and be the change. If there's something, use evidence to make positive change. So our students graduate at all levels, whether it's undergraduate or graduate, and they're really making changes in the world. We have students that right now are studying in Ghana. We have students that have worked with the Cayman Islands Health Administration to really change some of the practice in their health systems and help them get a Universal Joint Commission accreditation. So we have students that part of their projects are real things, real life. They're making impacts as they complete their projects.
Well, and in particular, and this has a lot to do with where JMU is located, and this aligns with some of your expertise, Dr. Eaton, is rural healthcare. And in rural areas, it's very difficult to find health care. And we're turning out students who have actual practical experience in delivering rural health care.
Exactly. For example, we just completed a grant, a HRSA grant that involved a rural health component that was rural RN primary care focused. And our students worked in a local community that's underserved, and they were embedded in that community, worked with the citizens, looked at their mental health, their access to care, and all of those issues that really impact health. We also have a rural outreach program that's interdisciplinary, that our faculty work with students in those very areas, and really help each area build capacity based on what they feel their needs are, not what we think they should do. So our students are really engaged from the beginning in all of those areas.
Well, that kind of immersive experience probably turns out a different kind of nurse than one that has not so much experience with caring about the entire reality of a rural community.
Exactly. So our students learn to know the continuum of care, that people begin in the community. They might go to, they might have to seek out health care, but they have to come back to the community. So really learning that up front and being embedded in those areas, whether it's through our community programs or working with hospital discharge planners, just knowing that the healthcare doesn't stop at the hospital door.
Interesting. Well, now JMU is engaged in a lot of initiatives in new curricula and capacity. We talked about being able to pay our faculty better after the allocation from the General Assembly. But tell us about some of the things that you're working on, not only to increase the amount of faculty, the ability to bring in more students, but also get them through quicker. And we're also even thinking about more buildings for the program.
Absolutely.
So tell us about that.
Well, our School of Nursing is very involved at the state level, so we have a really good pulse on what's going on, what the needs are. For example, programming that we support here includes advanced practice programming at the graduate level. So we worked with the state to really help with our preceptor issue. We had a lack of...
What's a preceptor?
Okay.
Yeah.
So preceptors are practicing professionals in the field that can help supplement and help us educate our students in clinical practice.
Got it.
In advanced practice, we started with the preceptor payment system at the state level. So we work with the state level to actually fund it from the state level and not each university. So that's really helped with the supply, the demand versus the supply in our preceptor population.
And unlike a lot of, just for our listeners, unlike a lot of different disciplines at the undergraduate level, you have to have practical experience.
Exactly.
It's like in some disciplines, whether or not you get an internship is based on how much you hustle. But in this case, it's absolutely required.
At all levels, not just undergraduate and graduate. So preceptors are key at all levels.
Right.
And what's been really helpful for us is having that state initiative. It was expanded to all levels. So we can now offer payment for undergraduate preceptors too. So that's helping at the practice level. Again, it's practice and education. And so JMU also linked with our practice partners in the area on a state grant called Earn to Learn. So we're looking at that practice ready RN and really having students start in a practice setting, whether it's Centera RMH, Augusta Health, or Valley Health, whatever that area is or that facility is, but they get involved with the culture of the facility while they're in school. So it's almost like it's an apprenticeship type program that they can earn some hours on their education while they're working.
Interesting.
And we really link with those practice areas as well, so that students, the goal was to be practice ready, but also to stay in the area and stay with those facilities for a while. So we're really looking at innovative programs like that. We also are looking at more of a flex BSN offering where students wouldn't have to go the normal hours to finish their degree.
And we're calling this the Fast Flex.
Fast Flex BSN. And it would operate in the evenings and weekends and summertime. So it would provide an education that is accelerated, that lasts 2 years, condensing it to one calendar year instead of 2 academic years. And it helps produce prepared nurses faster.
Wow.
We'll be right back.
One of the things that our listeners may not know is that almost a full 25% of the student body at JMU is in the College of Health and Behavioral Studies. It's really a significant portion of what we're delivering in terms of education at JMU. And nursing is just one part of that large college. The college is actually looking at expanding physically. In fact, there's plans potentially to build a building that's kind of near the Wine Price building. Tell us, Dr. Eaton, about how that would help to expand our ability to turn out more nurses.
Well, Andy, the spaces in the new building are planned to really include a larger simulation space for nursing and skills labs, and those are critical to the education of more nursing students.
And the simulators are important because it's really hard to get more clinical hours, right?
Well, they're a supplement to clinical hours,
Supplement, okay.
And they can count for a portion of the clinical hours. So in hard hit areas or areas where it's really more difficult to find placements for students. In some of the specialty areas, the simulation's used more for those areas. The other thing, and the most important, one big important thing that we're working on, that we have competency-based education
Tell us
coming
about
down
that.
down the pike here. So competency-based education is mandated by our accrediting agency at the national level. And when I say competency, I don't mean just skills. I mean simulating those skills, synthesizing, all of those things. But the key is they're going to have to really have more testing, more competency readiness, and those labs make a big difference in that as we move forward. We're in the process of changing our curriculum to match those competencies, so immediately we're going to be utilizing the labs tenfold.
Well, now, one of the things, Dr. Eaton, that you and I have talked about in the past is advocacy at every level being an important element of nursing education, especially as healthcare is evolving so rapidly. The delivery of care with new technologies, with artificial intelligence, it's changing so quickly. How important is it for students to learn that advocacy at every level?
It is extremely important. Students really, to prepare that student for the evolving healthcare arena, students really need that at every level. And we do a really good job at that. At the BSN or undergraduate level, they're engaged in a health policy summit. I'm just giving you a couple examples.
Yeah.
A health policy summit that's interdisciplinary.
And this is where students from other disciplines come together and talk about policy.
Well, they talk about real problems
Right.
in the state or federal, and they take a legislation and work on it in real time. They do, we use a Michelson's team-based model where they work on it. They present it. We invite legislators to that event. We do a gallery walk and vote on the best three, top 2 or 3. And then they do an elevator speech to that legislator that very day.
Talk about advocacy.
Yeah,
Right?
So those are undergraduate students.
Right.
At the graduate level, we have a Health Policy Institute in which our students spend a week or sometimes 6 weeks on Capitol Hill with policymakers. This last session, we had students, both with representatives at the federal level and senators. And different organizations like our American Nurses Association or our American Association of Colleges Nursing Policy folks. So they're exposed there. And we're just starting a health policy certificate that's interdisciplinary as well. So we really want our students, we know that healthcare is a team-based sport. And until we think out of the box, we aren't going to change things. So we can't do what we've been doing and keep doing this and have the supply of healthcare workers we need for the future. We have a population that's growing in the age range of 60 and above, and they're demanding good healthcare, and we need that supply. And you know, our projections from the Bureau of Labor Statistics for up to 2023 say that the growth in the RN workforce is supposed to grow by 3.1 million. They also project that there'll be 177,000 new nurses, but there'll be 193,000 jobs that are needed to fill.
So it's not spanning the gap.
We aren't covering the gap. So really looking at new ways to educate, new ways to work among disciplines, which is really part of our culture here at JMU, is really working cross-disciplinary. And in our college, that's the beauty of our college, is that we intermingle our students in all these projects from start to finish. So they really have that breadth and depth of knowing that healthcare is a team sport. It's not a solo sport.
Well, and also kind of like teachers, nurses and other healthcare professions are kind of a calling rather than just a career that one selects. How do you see those students really blossom during the curriculum in the way that we deliver the education?
Our faculty cares so much about student success at JMU. Teaching is the emphasis. Our faculty love what they do, and they really, really care. And they bring that professional demeanor in everything we do. So students from the very beginning, whether it's in class or out of class, in some of the different organizations we have here, they learn that culture at JMU. It's being the change, but it's being that friend and being where you need to be when you need to be it.
And that's advocacy at every level.
It is.
Okay.
It really is. And, you know, JMU, this past year, we ranked in the top 100 in our graduate programs nationally. And we ranked number 2 in Virginia RN careers at our undergraduate.
And that's out of there's 61 schools in
at
Virginia?
Least.
Yeah, and we're number 2.
Yeah, that's pretty good. We should be number 1.
All right, that's your next project, Dr. Eaton.
But, you know, I'm so proud of our students and our faculty in the School of Nursing and at JMU. I mean, we that's why I'm a Duke, you know. I came back. I think I was the first faculty they hired back that was a student here.
Oh, all right.
And I won't tell you how far back that was.
Okay.
But anyway.
It's your secret.
But we, you know, we just produce students that are professionals from day one. And we have our practice partners telling us this, even when they have their own nursing schools sometimes. They're like, we like JMU students, graduates. So.
I'd love to hear that.
Yes.
Well, Dr. Eaton, it's been a real pleasure having this conversation with you, and we look forward to the JMU nursing program continuing to help solve the shortage crisis in Virginia nationally and internationally. Thanks for being on the show.
Well, thank you for having me.
All right, listeners, remember, if you've got an idea for an episode of Being the Change, you can reach us at beingthechange@jmu.edu. Until next time, go Dukes.
Thanks for listening. Tune in next time to hear another story of how members of the James Madison University community are being the change. Dive deeper and consume countless other stories at jmu.edu/Madison Magazine. Go Dukes!
The Being the Change podcast was conceived by Jim Heffernan, editor of Madison Magazine, and me, Andy Perrine, head of JMU Marketing. Thanks to Jenna Polk and the team at Rose Library Studios, where the show is recorded by Steve Adderton, the guy who also captures those amazing campus drone shots you see on Instagram. Original music by Neil Perrine, and episode production by the Downtown Creative. All of us involved in creating Being the Change are JMU alumni, and we bleed purple. You can find the Being the Change podcast on all popular platforms, where we hope you'll like, share, and subscribe.